What is hematuria? Understanding blood in your urine. Imagine seeing a hint of pink or red in your urine and wondering what it could mean. That's what hematuria is, the presence of blood in the urine. It can be so subtle that only a microscope can detect it, or so obvious that your urine looks bright red or brown. When blood is visible without a microscope, it's called gross hematuria. Sometimes, even a small amount of blood can turn urine a different color, making it noticeable. Other times, blood is only detectable through laboratory tests, which is known as microscopic hematuria. Hematuria is not a disease itself but a symptom indicating something might be happening somewhere along your urinary tract. This includes the kidneys, the tubes connecting the kidneys to the bladder called ureters, the bladder itself, the urethra, and in men, the prostate gland. Blood can leak into the urine from various causes, ranging from harmless to serious. Common reasons related to bladder health include infections or inflammation of the bladder or urinary tract, which can cause irritation and bleeding. Kidney stones or bladder stones can also cause bleeding when they scrape against the lining of these organs. Trauma from injury or vigorous activity may lead to temporary blood in the urine. In men, an enlarged prostate, known as benign prostatic hyperplasia, can cause bleeding as well. Sometimes, certain foods or medications can change urine color to look like blood, so proper testing is essential to confirm whether blood is truly present. More serious causes involve conditions like bladder cancer, kidney cancer, or prostate cancer. Blood clotting disorders, kidney diseases affecting the filtering units called glomeruli, or blood conditions like sickle cell disease can also cause hematuria. Often, people with hematuria do not experience pain, especially if the blood is only detectable under a microscope. When blood is visible, urine may appear pink, red, or brown, and in some cases, blood clots can block the flow of urine, leading to discomfort or pain. Additional symptoms such as painful or frequent urination, urgency, lower back or abdominal pain, fever, or chills may point to infections or other underlying issues. Because hematuria can be a sign of serious health problems, including bladder cancer, especially in adults over 35, it should never be ignored. Medical evaluation usually involves urine tests, imaging scans like ultrasounds or CT scans, and sometimes a procedure called cystoscopy, where a small camera is used to look inside the bladder. These tests help identify the source of bleeding and determine the underlying cause. In summary, blood in the urine can come from many different causes, some harmless and others requiring prompt treatment. Recognizing hematuria and seeking medical advice early is crucial for maintaining bladder health and catching potential issues like bladder cancer in their early stages. Treatment depends on what the doctor finds and may range from simple observation to medication or surgery. Always consult a healthcare professional if you notice blood in your urine to ensure proper diagnosis and care.